What do you learn in med school anatomy lab? Have you ever wondered what happens in an anatomy lab during medical school? It is a fascinating place where students gain hands-on experience with the human body. In the first and second years of medical school, anatomy labs play a vital role in shaping future doctors. In these labs, students study the detailed structure of the human body through dissection and examination of cadavers. The primary goal is to understand how different parts of the body are organized and how they function together. Students start by learning basic anatomical terminology and directional terms. This foundational knowledge helps them accurately describe locations and relationships within the body. As they progress, students dissect specific regions of the body, often following a regional approach. They might begin with the back and extremities, then move on to the head and neck, thorax and abdomen, and finally the pelvis and perineum. This method allows them to see how muscles, bones, nerves, blood vessels, and organs are arranged and connected in 3 dimensions. The lab experience is rich and varied. Students dissect muscles, bones, nerves, and blood vessels to appreciate their relationships. They identify major organ systems, including the respiratory, cardiovascular, digestive, urinary, and reproductive systems. This hands-on approach helps them connect what they learn in textbooks to real-life anatomy. Another important aspect is correlating anatomical structures with clinical imaging techniques. Students learn to link anatomy with diagnostic tools like X-rays, computed tomography scans, and magnetic resonance imaging. This connection is essential for future clinical practice. Students also study variations and common pathological changes, such as fractures or aneurysms. This helps them understand how anatomy relates to disease processes. Additionally, they integrate embryology to learn how anatomical structures develop and how developmental anomalies can occur. Practical skills are a big part of the anatomy lab experience. Students gain careful dissection techniques and learn to use anatomical landmarks for orientation. They also develop critical thinking skills to apply their anatomical knowledge to clinical scenarios. Anatomy labs often combine cadaver dissection with prosected specimens, imaging, and small group discussions. This mix reinforces learning and helps students retain information. Overall, the anatomy lab in medical school provides a foundational understanding of human body structure. This knowledge is essential for clinical practice, surgery, and interpreting diagnostic tests. It prepares students to recognize normal anatomy and identify abnormalities that can affect patient care.